we can. Okay, thank you. Good afternoon, good evening, everyone. Thank you very much, Maria, for your kind words, and thank you for the invitation. Thank you for letting us be here and share a project that is still an ongoing project that we've dreamt of for many years. So it's very, very dear and special to us. As Maria said, the purpose of this study, which, well, we are just starting, so I will just bring the goals and the approach, but I cannot summarize results yet. It's about the clinical efficacy of a low-histamine diet and the efficacy of DAO enzyme supplementation for symptoms associated with histamine intolerance due to DAO deficiency. Let me start. Just, can you click? Yes, that's what I'm doing. Yeah, here. So as I was saying, I have this sentence with me. A quote by Carl Sagan, which is a scientific disseminator, not specializing in diet, but well-known scientist. Absence of evidence is not evidence of absence. And this quote, I think, is a perfect frame for this idea of histamine intolerance and the scientific evidence we've gathered so far. Here you see a graph representing how papers have evolved in recent years. And what I mean is this is quite a novel topic. Okay, let me use a pointer. Around 80% of all papers have been published in the last 10 years. And so if we go to 2022, 2021, the number of papers in the world isn't very high, though. What do I mean by this? Well, this is a novel topic, it's a new topic. And as with any novelty, there are still many features to be studied. First time that histamine intolerance is mentioned is in 1990. In 2022, we see there was, well, this is our year, isn't it? 2022, and that's where we see the largest amount of papers. Even though there are not so many papers compared to other scientific topics, I think it's important to highlight 3 quotes that are significant because of the significance of the bodies that issued them. In 1999, the European Academy of Allergology said, and again, this was 1999, it's necessary to carry out controlled clinical studies with a significant number of patients in order to define the clinical role of histamine intolerance in provoking allergy-like symptoms. And it's important because it's 1999, we were saying already that clinical trials were needed. 2011, that's when the European Food and Safety Authority was, for the first time in a scientific opinion on biogenic amines such as histamine and others, they distinguished the well-known syndrome compared to the histamine intolerance, which, according to the report, was due to a lower DAO enzyme activity due to genetic causes and GI problems, and even drugs that were DAO inhibitors. We also found important this other mixed report by FAO and WHO in 2013, where histamine intolerance is defined as a food intolerance with allergy-like symptoms that occurs where histamine-rich foods are consumed by susceptible individuals. So these are 3 examples, 3 mentions or papers that I think are the basis that underpin the research on histamine intolerance, as we said, defined by the inability of the individual or a reduced ability to metabolize histamine in the gut. On the left-hand side, you see what's going on. Histamine levels are normal or low, and for most of the population, there would be no impact. But when this amount of histamine coming from food are taken by those individuals that have reduced DAO activity in the gut, what happens is that this food histamine cannot be degraded, so it moves into the blood flow and it accumulates and leads to a series of symptoms that you can see on the right-hand side. And as you realize, are very diverse in its nature, because histamine, as you may recall, has very significant physiological features and functions. So the problem is always to have an excess of histamine. Due to its significance and work in different systems, we realize that when there is a plasma excess of histamine, we can also find symptoms in different organs, such as the GI tract, or the respiratory system, the nervous system, circulatory system, and probably the best known symptoms are those of the skin. And a feature of the population with histamine intolerance, let me say that usually there is a variety of symptoms. It's not common to just have symptoms in a single organ or system. Actually, according to some papers, the average would be somewhere between 7 and 10 symptoms when there is histamine intolerance, and we're talking per patient. I said that the accumulated evidence need to be widened. There are some, but not enough. Yet several potential causes or origins of histamine intolerance have been proposed. First, a genetic deficit that would be due to, well, or actually, this is because SNPs have been identified in the gene that encodes DAO and leads to lower enzyme activity levels. There are some other papers where we see histamine intolerance, that it's an intestinal inflammatory disorder. This inhibits or hinders the secretion of DAO, so it would be another potential cause. It's been mentioned, but there's lack of evidence, even though it's very interesting. The fact that there can be histamine intolerance symptoms as a result of drug interaction. So there are some drugs that has been described by the literature, but understudied, though, where what happens is that the drug that initially and reversibly and temporarily inhibits the enzyme activity. And I know Sonia mentioned it earlier today, but let me also insist on the fact that in recent years, there's been another element that might be either the origin or the result, as it happens most of the time with gut disorders. But I'm talking here about the intestinal dysbiosis and its role in the etiology of histamine intolerance. I should like to add, and I think it has to be taken into account, that all those circumstances can be added, can be summated. There can be a summation of different causes, such as genetic or intestinal or pharmacological, and some degree of dysbiosis that can also explain the severity in the symptoms or the intolerance. As for treatment, drug treatment would be through antihistaminics, histaminic drugs. But if we talk about dietary treatment, there are two different strategies going on. First one is common sense, isn't it? Using low histamine diets. Seems easy enough, but it isn't as easy as it seems. It's very difficult to have a line between those foods that have low or high histamine concentrations, and the other strategy would be using enzyme supplementation, DAO enzyme supplementation, to promote histamine degradation in the gut. I think it's important to highlight that since 2017, the porcine extract, it's DAO, kidney extract. So from kidney, from pig kidney, is novel food. As for our study, well, in literature, we've found some 15 papers up to 2022 with different studies to see the efficacy of low-histamine diet for the remission or relief of intolerance symptoms. Most of these studies have been done on patients that had skin symptoms. As you can see here, this is green mainly. This is a percentage rather of patients with some improvement of symptoms, except for one case. But all other 14 studies show there is an improvement of symptoms with different intensity. Some of them 100% improvement, some others, like this one, 33%. These studies bring us evidence on the problem, but we also need to admit that there are significant limitations when it comes to scientific validation, one of which I would say is up here, number of patients. Number of patients that have been part of this study is relatively low, except for this one here with 157. But the others are usually somewhere around 50 patients, so not many. Another weakness, significant weakness, is that has no control group in most of the cases. And another limitation that I think is very, very big is the fact that the intervention time is reduced from a few weeks. It is just this one that the treatment was extended to 12 months. Oh, this one here, which is 18 months. So generally, most of the studies have reduced intervention time. So it is clear that evidence has its weight, but we need to test them and counter-test them with better quality studies. This is an example of the studies, and here you can see patients that have chronic urticaria. These are 22 patients. On the right side, you have the results. As for symptoms, we see that after a histamine-free or low-histamine diet, symptoms do improve, and the improvement is progressive throughout the 4 weeks that this study was developed. And on the bottom side, we see changes in plasma histamine levels. And we see that after the histamine-free diet, there was a reduction in the plasma histamine levels and an increase in the activity of plasma DAO. This is a study with patients who had GI symptoms. So total 63 patients, and around 80% reported an improvement of symptoms. And as you can see on screen, this first part of the graph, for those patients who had an improvement of symptoms, there's also an increase in plasma DAO activity, but this increase is not reported in those patients that did not improve after following a histamine-free or low-histamine diet. Let's move on to those studies we've found in literature about the efficacy of the use of enzyme supplementation. You see that the number of papers is even lower. We could only find 5 in literature that tackle it. Let me also say that there are weaknesses to these all. We see reduced study population, as generally speaking, also limited intervention times, 2 to 4 weeks. And also, and this is important as well, because they were not standardized, meaning that they were using different supplementation doses. despite of all these limitations, in all cases, the results, and you can see those here, meant or recorded a significant improvement of symptoms that are linked to intolerance if the DAO supplementation treatment is used. As I said before, these are small evidences that call for a larger, better designed study so that they can be taken for true facts. And this is just an example from a study where this DAO supplementation treatment was used. And it was the evaluation of 20 new symptoms, different levels, through standardized questionnaires. And here it was 28 patients. For 4 weeks, they had a low-histamine diet and DAO supplementation. And for the next 4 weeks, they kept the low-histamine diet, but without the supplementation. And the results are self-explanatory. I think symptoms improved and were reduced all the way down up until week 4. And when the DAO supplementation was discontinued, symptoms went flaring up again. And here on the right-hand side, you can see that for this study, DAO plasma levels were unchanged despite the treatment. And as I said, all these studies have been done using with a porcine DAO. Porcine DAO, as I said, is considered novel food. We've been working for some years now trying to find other sources of DAO enzyme. And specifically with Dr. Carmen, we've seen that there is DAO activity in legume sprouts, and this activity, in most cases, is compared to porcine DAO. We're talking about peas or sprouts germinated of peas. That's where we find a DAO activity, which is comparable to that of a porcine origin. So what's the goal of this study? To assess the clinical efficacy of low-histamine diet or DAO enzyme supplementation in the dietary management of symptoms associated with histamine intolerance due to DAO deficiency. Secondary objectives are to compare the efficacy of different types and dosages of DAO supplement, comparing animal and plant origin at different doses and dosages. As we said, this is quite new, this concept of histamine intolerance, and evidence can be summated, but we need to compare. So on top of the efficiency of the diet and the supplementation, we want to have new evidence on other items that are not treated related, but actually etiology and diagnostic related. And that's why as secondary objectives of this study, we want to assess the usefulness of the histamine metabolites in urine as biomarkers of histamine intolerance so that it can be used as diagnostic tool. Also to assess in depth the relationship between histamine intolerance and the intestinal microbiota to see to what extent the dysbiosis is related to the onset of symptoms, and to finally to assess or increase evidence regarding the assessment of prevalence of genetic DAO deficiency in relation to other parameters, whether plasma levels or metabolites in urine. You have 3 minutes. Perfect. Thank you very much. This study has been led by Dr. Struch, that will take the floor in a minute, and myself as main researcher for this group. This is just a team effort. We are the group working on bioactive amines and polyamines of food in the hospital in Barcelona. This is a double-blind, randomized, placebo-controlled, and unicentric intervention clinical trial. Study duration 3 years and intervention period 3 months. So it lasts way longer than the studies we said before. It's been approved by the ethics committees, and the protocol and the standards are in order so that we would have patients' consents and everything else. I'll rush through it. This is an ambitious study. It's 400 patients randomized into 8 intervention groups, 50 people, 50 individuals per group. And as I was saying, we would assess 2 doses of plant-derived enzyme that would be taken orally 3 times a day compared to a Mediterranean diet, so the standard regular diet but unsupplemented. And first row is the efficacy of diet, and bottom line is all 3 studies with the different DAO doses of plant origin, but it's not the Mediterranean diet but a low-histamine diet. This is the synergy between the low-histamine diet and the supplementation. This diet, as I said before, seems to be easy, but it is not. And so one of the problems or weaknesses that we find in the studies that I mentioned, and you can see that on screen, where you see all different diets used in the 15 studies I summarized. As you can see, there is little consensus about the foods that should be ruled out. Let me be brief about it. The first 4 would be excluded in all diets: dry fermented sausages, cured meats and cheese, beer, wine. But in some diets, they also discard kiwi or grapes or milk, but not in most of the others. So the first stage of the study, our study, was to have dietary tips and tricks for a low histamine diet. I said it's an easy because when we talk about histamine, well, there is not a standard amount of histamine in a given food. It's depending on several factors. We can have a batch where level is A, but the same product, different batch, and it can go as high as 10 times higher. And it is not part of the labeling obligations, so it's difficult when a diet is needed. So we agreed that based on the literature that we knew and the experience of our research group with over 30 years of experience, we decided that what's best is that patients that would be part of this study will be given a piece of paper with the foods that are excluded and those that are allowed. Not so much about a strict diet, where it would be much more difficult to have patient compliance and adherence. Supplements, as I said, we'll be using and comparing the porcine DAO that we are familiar with, and also the pea sprout or the plant DAO, 2 different doses, and then of course placebo that will be similar to the supplement but without the active ingredient. As for inclusion and exclusion criteria are very important for any intervention study, of course. And here we see they need to be adults over 18 years of age with symptoms of histamine intolerance affecting at least 2 or more organs or systems, and then at least low plasma DAO enzyme activity, or they need to show or they need to show some of the genetic variants that we find in literature and mentioned by other speakers that have to do with lower DAO enzyme activity. And of course, dietary treatment with low histamine diet before recruitment. Exclusion criteria, of course, making sure that there is no food or environmental allergy, that they are not undergoing treatment with antibiotics or probiotics, and if they're women, they should not be pregnant. All those eligible patients will be recruited at the Hospital Clínic de Barcelona in the services that are allergy, digestive, and dermatology. As for the protocol, Dr. Vidal, you need to finish. Yes, just 2 slides left, if I'm not mistaken. First visit. Patients will be selected based on symptoms. If they have symptoms that are compatible with histamine intolerance, we'll check the DAO activity and the presence of SNPs that, as we said, are the inclusion criterion. As for the first time they come to us before the intervention, of course, we will take the medical history, we will take the samples for the blood and biochemical analysis, also validated questionnaires will be taken, determination of histamine metabolites in urine, analysis of GI microbiota, and diet compliance. Here you can see those questionnaires, validated questionnaires we'll be using. Here you see the determination of metabolites in urine based on the experience of the group that actually said that these levels of histamine, methylhistamine, is higher in control population compared to those that are intolerant, which I think is another reason to be hopeful that we will find a marker for intolerance so that diagnosis will be easier. I will not dwell on microbiota as explained by Sonia, but it's important to say that even with few cases, we see changes in the gut microbiota. So we see that Enterobacteriaceae are more active, and it has to do with the histamine production ability of individuals. And then for follow-up visits, just the same, several controls, as I said before. Let me also say that all participants will be encouraged to keep on with the study. And finally, this is the research group. Thank you very much to all of you for your attention, and thank you to them for their hard work. Thank you very much.